I'm joined by Laura Kern, Administrative Director of Patient Access at the University of Toledo Medical Center. Laura is a panelist at our upcoming Patient Access meeting on a session focused on patient estimates and the No Surprises Act. Laura, thanks so much for joining us.
I'm excited and eager to be a part of the
Thank you so much. Discussion. To get started then, could you share with us a little bit about your background, some of the roles you've had in healthcare thus far, and a little bit about your current role at the University of Toledo Medical Center?
Sure. So I think probably similar to a lot of folks in patient access, it wasn't linear, right? I didn't think I was destined to be a patient access director, didn't even know it existed. So I started my career in healthcare in high school on the clinical side of healthcare. And as I learned what healthcare is all about and evolving in that healthcare system I was in, was able to have the opportunity to kind of just dip my toe into patient access to get an idea of what it was about. I actually started with doing some authorizations for surgeries and radiology and learned a lot and certainly opened my eyes to that. So then during my progression, I spent some time in finance as an analyst and realized, although I learned a lot as an analyst, that interacting with people more regularly was more in line with my personality. I did spend some time in a clinic environment in a leadership position before coming to UTMC. At UTMC, I've held, I think, just about every management role within patient access. And so where the director position came up, it seemed like a natural progression. So that's how I arrived at where I am today.
What a terrific background. And I think that so many of our participants and the other panelists, they also really embrace this, working with patients, the frontline work has been such a common theme.
Yeah, I agree. And, healthcare has many faces and skill sets. So, I've been spending a lot of time, interestingly, talking to a lot of high school students that, healthcare isn't just about the clinician piece. So, that's not it for everyone. There's lots of different realms. So it's just interesting to put that knowledge out there because as you're starting your career, you certainly don't know what's all out there.
No, certainly not. Well, we're really looking forward to having you participate on our panel related to patient estimates and the No Surprises Act. Might you share with us one aspect of estimates that your team is working on improving this year?
So we've been lucky. In September, we just went live with Epic. So meeting and complying with the No Surprises Act in our legacy system was a lot more challenging and manual. So we are really relishing in having the tools that Epic provides, but it's really optimizing it. We want the system to work for us as much as we can and not make everything so manual. So that's really where we are in getting not only the estimate tool up and running to where we need it to be, but then really understanding it enough to optimize that, especially with the patient communication piece of the No Surprises Act.
And there are so many things to discuss when it comes to estimates and, as you say, communicating those to patients, making sure that they get them, whether you're using MyChart or manually mailing them to patients, whatever the approach might be. When it comes to the meeting taking place this July, what's one thing that you're looking forward to discussing or benchmarking with peers?
Well, I think a community of peers sharing their experiences and transparency, even beyond benchmarks, sometimes it's just workflows, right? And I think that's great to have a platform to do that. With estimates, the accuracy piece, I think, is what really weighs on my mind and probably a lot of my colleagues across the nation. So I think that will be the biggest piece, is making sure, the notification and getting the estimates out is not as big of a concern for me. It's being compliant to that accuracy piece.
Definitely. And we've heard so much about the challenges with accuracy, whether it's changes to the codes of what was originally ordered versus what is actually taking place. Or whether it's an eligibility issue with the insurance. There's so many different pieces that need to align in order to get that accurate estimate. So I think that this is going to be a great discussion, and we're really looking forward to having you. And thanks so much for coming on and sharing a little bit about your background with us.
No problem. Thanks for having me, Kate.
Thank you so much.